Hello, my name is Brian Harrington. I'm an accredited addictions counsellor, an accredited generic psychotherapist, and I run my own business in the centre of Dublin called Next Step Therapy, and I've been there since I returned back home to Ireland in 2013. My business is now successful, my caseload is full, and I have a waiting list. The clients I work with are mainly, not entirely, but mainly people who meet the diagnostic criteria for substance use disorder, either alcohol or other drugs, and who also, and this is the important word, who also have an underlying or a co-occurring trauma, complex trauma or developmental trauma, which is PTSD. People use drugs very, very often as a form of medication for the distress caused by trauma, by complex trauma. Nearly all of it, 99.9% of that trauma, is based in a childhood, in adverse childhood experiences. So we screen for adverse childhood experiences. We screen for symptoms of PTSD. We screen for symptoms of dissociation. We screen for symptoms of addiction. And they are the clients we work with. They're very resistant to treatment because people generally use the substance to help to manage the symptoms of the trauma, and in time the substance use itself becomes its own trauma, having an impact on brain chemistry, causing a change in mood, causing a change in behavior, causing a change in how the person is in their own life, in their family, in their society, and in the state at large. So the impact of an individual's use of drugs has in effect far wider than just that individual, but I think people mainly know that from observation. I intend to work with that. Now, I'm already doing that. So the problem is that I cannot do this on my own, and I can only work with a limited number of people. Because I run a business, I need to keep the business going. Therefore, I can only take a limited number of low cost cases. So I'm trying to start up this social enterprise to widen out that net. So I can, so as well as working with other clients, I can be a bridge between the clients who need help and those other therapists in Dublin who can offer help. The people who are trained to work in that area are very, very small, and I already have a list of those people, so it'll be bridging that. My role will be assessment, case management, looking after rooms, looking after advertising, looking after supervision of the therapist, looking after all the case management stuff that needs to be done. I will be funding that through social enterprise. I'll be funding it through a room hire business. I'll be funding it through a drug testing business as well. Both of those businesses will feed into the social enterprise and provide funding. So that is where I am at the moment.